Okay, so Dr. Buford, we're just getting started on the right knee. We're looking in the medial compartment here, and we're just using that instrument you see, a shaver, just mostly because it has suction on it right now. And as we irrigate the knee, we can see where the meniscal tear is. It's in here in the back. We can see a split right there, and we know that it's also split underneath. And so we're going to get to work on fixing that, obviously. Now I'm going to look around the rest of the knee first. This is the central part of the knee. There's going to be a little bit of soft tissue in the way that we can clear out so we can see the anterior cruciate ligament. Okay, there. So now the anterior cruciate ligament's back here. And from your MRI scan, we know that that's not damaged, but we always double check. We're going to look in the lateral compartment in just a minute here. Going to flush out. And as we do that, we can see this lateral meniscus so far looks pretty good. Help me bend the knee a little bit. Just like that, yeah. Take this up there. Just pull that whole shaver up there. Lift up on the ankle and pull it towards you. Okay, so now we get a better look in this lateral compartment. The MRI showed that this really didn't have a tear in this meniscus. It looks pretty good. We're going to probe it in a little bit, but so far we're just confirming everything that we found on the MRI scan. Okay, now we're going to look up at the patellofemoral joint, which is going to be up here, and you've got some, hold the leg like that for me. You've got some arthritic changes here. This is one of the reasons we discussed the PRP injection. The other, of course, being the medial meniscus repair. So we can see a little bit of chondrosis on the undersurface of the patella at the top of the screen. Nothing seems to be overly loose. And then down here in the trochlea, we can see some of this cartilage is a little bit loose. We're just using the shaver to make sure there's nothing that's really loose or about to become a loose piece. But so far, so good. So you've got, I guess, what we would call grade 2 or maybe even grade 3 changes in the patellofemoral joint. And this looks to be the worst compartment as far as the arthritis. Pause. Got it. Okay, I just want to show you what we're dealing with here. We've got this radial tear in the back right here, and then we've got this undersurface tear right there. So it's probably going to be 2 implants. Hold the camera here, just 2 hands on it. So one hand's always on the light cord, and then just try and keep me in the middle of the screen. That's a great shot right there. Okay, so let me see the fast fix. We're going to go ahead and pause for a second. Okay, and then let go. Okay, no, you're good. So see that red? So we've got this first stitch in. We're going to go ahead and snip the suture now. Okay, and so there's our first stitch. So I think just from looking at that, you can see what we're trying to do to hold that together. I still want to put in another suture, so we'll get another implant ready to go here in just a minute. Okay, so we've got 2 sutures in now. And as I range the knee, or just let it flex, we're just checking the stability of that. So far, so good. Okay, we'll keep looking here. Okay, so we're probing this. We've been testing it. It seems very stable. I haven't been able to displace it at all. I don't think there's room to put another radial stitch in unless maybe we went up here. And I don't think there's a reason to go more anterior. Let me see a probe, please. We're just deciding if we're going to place one more implant. Okay, so we've placed another radial suture. You can see now we've got 3 implants in, and that looks very good. We're going to go ahead and finish up here and get you back to the recovery room shortly. Okay, we're going to place the PRP next, and it's going to go back at the meniscocapsular junction. We'll show you that in a little bit. Okay, we're going to put the PRP in a couple different places, trying to avoid the implants. This is just going below, and we'll get one above, but I just want to show you what that needle looks like coming in. Okay? So good luck to you now. This will be the end of the surgery. Bye-bye.